I saw Devin Jones today. He's a 40-year-old African American male that came in with uncontrolled hypertension. He is a police officer that works in a high crime area. He told me that he doesn't exercise only when he has to do his training drills. He shared with me that he's gained 20 pounds in the last year and that he has shortness of breath when he goes up steps. It's also significant to note that his mother and father died of complications from hypertension. His mother also had diabetes. What is hypertension? Well, I tried to explain it to Devin the easiest way that I could. Hypertension is caused from high blood pressure. It's a chronic medical condition in which the pressure in the arteries is higher than normal. And this means the heart has to work harder to pump the blood to our organs. Blood pressure in the arteries change depending upon the activities that we're doing. There's two numbers present in a blood pressure reading. The systolic, which is the top pressure, and that's the pressure or the number that is measured when the heart squeezes the blood out into the arteries to our organs. The bottom number is the diastolic. That is the pressure of the heart, that is the pressure of the blood against the walls of our arteries in between heartbeats. There are three types of hypertension. Primary is one that is not caused by underlying diseases. It develops as we age over time. We also can develop primary hypertension from our parents, genes. Since Devin is a first-degree relative and his mother and dad both died of hypertension, he is at a very much higher risk to develop it. Physical changes in our body also leads to primary hypertension. Secondary hypertension is usually caused by an underlying disease. It can come on very quickly, such as the case with thyroid problems or alcohol and illicit drugs. Complicated hypertension is such as endocrine disorders, congenital defects, or kidney problems. After speaking with Mr. Jones, I told him the most significant risk in his history is not only heart failure, but peripheral vascular disease. I told him that peripheral vascular disease occurs when uncontrolled hypertension goes without treatment. This damages the arteries and the vein walls, and this leads to a narrowing in the arteries. Essential hypertension eventually can become complicated hypertension, which of course essential hypertension is also primary. Part of the problem with peripheral vascular disease is it attacks the veins in the legs, feet, and hands. Again, increased blood pressure on the artery walls causes damage and can prevent adequate circulation. Due to the adequate circulation, it can cause blood clots because of the narrowing and the damage to the artery walls. It can cause wounds that can lead to gangrene and infection. This can lead to loss of limbs. Pain when we're exercising and at rest. This is called claudication. So we talked about what he could do to improve his risk of peripheral vascular disease and his hypertension. The first was a lifestyle change. He needs to change his diet. He needs to go to a low-fat, low-sodium diet. Exercising regularly, even 30 minutes a day, would help. This also would lead to weight loss, which could also control his blood pressure. Medication may have to be added if the exercise and the diet doesn't control it. We also discussed that he needs to decrease his alcohol intake. Also, relaxation, yoga, deep breathing to help control his stress. Mr. Jones said he's going to try, and I'll see him in the future.